So I'm going to stop there. We're going to introduce our panel. We have about 20, 25 minutes for a discussion, and then hopefully some time for Q&A. All right? So rather than me taking the time, let's just have everyone go see, and then we'll just start at the end. Introduce yourselves, where you're from just real briefly, and then we'll jump into some questions. Go ahead, Heidi, why don't you start?
Okay. Am I on?
You're on.
I guess we're on. My name is Heidi Dohse, and I am involved in 2 transformational partnerships with the UCSF. One is being a part of the Healthy Heart Alliance, and the second is the Google Cloud Platform, which is a enabling technology for the Healthy Heart study.
Thanks. Tuin?
I'm Tuin Sinha. I'm a former UCSF alum. I helped design and build the Healthy Heart study, and then more recently have spun out a company, Vital Labs.
So I'm Greg Marcus. I'm a cardiac electrophysiologist, so see patients do procedures primarily related to arrhythmias. Also the director of clinical research for the Division of Cardiology at UCSF, and one of the principal investigators of the Healthy Heart study.
Great. My name is Marco Peluso. I'm CEO of Qardio. We're one of the technology providers for Healthy Heart with our sensors for blood pressure monitoring and ECG.
Okay. So we've assembled a panel here that has both involved patients, very large industry partner, smaller industry partners, creative genius, and the actual investigator. So we can give you all the aspects of how this partnership came together. But I think it's worth starting with kind of the why. The why is everyone here, right? Because this is a pretty unique group that's been assembled to try to support and foster the alliance. So let's just start on the far end. What was in this that really attracted you personally and the company to participate in the alliance?
Well, I've been a lifelong heart patient, and I'm a project here at UCSF for the last 30 plus years. So for me, the opportunity to go from being a anonymous subject to a participant with a voice at the table to really change how heart disease is diagnosed and treated was just a fantastic opportunity, and a different way of approaching how we deal with heart disease. And the Healthy Heart Alliance allows that.
So talk just briefly about, so people who see that there's the relationship with Google say, oh, well, Healthy Heart's just using Google Cloud services, they're great cloud services. Is there something else that Google is looking for?
Yeah, so the relationship with Google and the Healthy Heart Alliance and the study is this opportunity to collaborate on how data is collected, all of the different channels, that the patient-generated data from sensors, medical records. How do we then analyze that data? I mean, that's something that Google does better than anybody else, is that whole thing, where you show that, yeah, we can collect the data, we can transmit it on our phones, it can go to the cloud, and then it just sits there. Google can actually help take that from the cloud to become analyzed and then actionable. And that's where we're really interested in collaborating with researchers and organizations, to see if we can't help to identify those trends.
Okay, so let's swing down this way. Marco, you've been in this for a while. You guys have not only, it's not about just selling devices, right? The partnership is much deeper than that. Talk about that a little bit.
Absolutely. So from our point of view, Qardio is interested in being involved in Healthy Heart and other initiatives like this. Is really driven by our desire to really drive the way people can feel more comfortable with sensing, monitoring themselves every day, and put that information in the hands of the doctors and other actors in the ecosystem that can really make the best use out of it, right? And so from our point of view, what we built drives the sensing side with sensors all the way to the actual dashboards, similar to what you were showing earlier for blood glucose, so the doctors have the information all in one place and really can put it to use.
So why do that through an alliance with a big trial? Why not just go down the traditional route of just building this yourself and just selling it to doctors?
Well, I think they are not two. They are an alternative path. I think our reason to be involved is really that we want to help everybody kind of become more familiar with what technology can do today, what digital health can do today, and find better ways to work together so that really we can minimize the number of doctor office visits that patient needs to have. And we really want to give much more information available to doctors so that they can do their job even better and give peace of mind to patients.
Great, great. So Tuan, you really love this space. I mean, you left a secure, academic, exploding career to go be in the startup world so you can do this work. So some people would say you probably need to be medicated. Other people would say, great, you're going to be successful. Why the Healthy Heart Alliance? So you've been there since the beginning. Talk to us a little bit about why it makes a difference.
So from my perspective, Healthy Heart is very, very interesting. So I got involved early on in 2012. And the reason I got involved, I was doing business development on campus, digital health partnerships with startups and big companies. And back then, there was a big gap between what was coming out of Silicon Valley and startup companies and what clinicians on campus really wanted. And what I found very interesting was Jeff Ogan, one of the PIs on the study, came to me and said, I don't want to come up with the technologies. I don't want to think about the innovations. I don't want to go into that creative process. What I want to do is just find all these people, integrate them into a very compelling research platform so I can validate what is ultimately very useful for clinical practice. It's like, this is a great way to partner with the community. And so that was the seed, and I totally bought into it, and we built out a great platform, I think, and it's been very, very successful. And yes, as a part of that work, I came to realize, look, there's a tremendous opportunity in cardiovascular disease management, and maybe I do need to be medicated, but it's a lot of fun, trying to build out a company that's based on some of the work that we did at Healthy Heart. Great.
So Greg, you've been in the clinical trials space. You've built a career around research. So talk to us about what, and I kind of teed it up in my prior comments about what's really fundamentally different about Healthy Heart versus the way you would just have done a very large clinical trial. And secondly, follow up with talking about, so what about everyone else after heart disease? Like, big deal. So heart disease gets everything fixed, and then what? So talk to us.
Sure. So I think just stepping back in terms of why we even created the Healthy Heart Study, it was motivated by the convergence of two major factors. One is this phenomenon where the cost of clinical research continues to go up while funding, especially from the NIH, continues to go down. So we clearly need a more cost-efficient approach to clinical research in general. Simultaneously, we have the emergence of all the sensors and technologies you described, the very common use of the internet, smartphones, et cetera. And that pervasive technology has really not been successfully leveraged in rigorous clinical research. And we recognized exactly what you touched on, Mike, in terms of how are we actually going to use this data? So you can say, oh, someone's wearing a Fitbit and they're getting their heart rate up and you're monitoring that. That must mean they're going to be healthier. But there's no data to support that. We need to study these things carefully. There's many examples in medicine where at first glance it looks like a given therapy based on the biological plausibility should lead to X, Y, or Z, and we're completely wrong. And we only find that out after we conduct a rigorous trial. Not to say, well, what is the right target heart rate? For what duration? For what type of patients? How to best leverage these sensors that Marco and people like him are developing. And we think there's much to do and a lot of kind of win-win opportunities for collaborators. Moving on to your second question regarding heart disease and other diseases. So we started out, so Jeff and myself are both cardiologists. Mark Pletcher, the other PI, is a cardiovascular epidemiologist. So our interest has, in the past, been primarily in cardiology. We set out to kind of create this cohort and this infrastructure to partner with technology companies, et cetera, and other investigators. What we've recognized as we've gone forward and been approached by companies and other collaborators is that what we've built is really relevant to any disease state, disease process interested in leveraging technology and using that technology to conduct clinical research more effectively. So we're moving, right now we're called the Healthy Heart Study, and we may be moving towards what we're calling the Healthy People Resource. We've already worked with urologists, pulmonologists, neurologists who are very interested in using the platform.
Can I riff off that just a little bit? So the other thing and I want to get back to your point about why doesn't the ecosystem work such that you can come up with a new innovation and just go door to door to doctors and just sell it, right? So as you know, that model is very, very difficult in the healthcare sector, and there's not a lot of venture investment that's going to listen to that type of business model and go, all right, that sounds like a really scalable, fast rocket ship type company.
But that was the model that worked great for pharma, right? I mean, they came out with a new drug and they went door to door and all the doctors bought it. Why doesn't that work?
They had clinical utility and clinical validity studies. So you have to go through the process of, okay, I have a new innovation, I have a new service, I have a new discovery. I have to go through the work of validating that with clinicians and then proving the utility so that the payer will go, all right, this thing actually works in the marketplace. So that's where Healthy Heart is profound, right? It is allowing folks to take that next step. Instead of just going, look, I have a new sensor that's going to revolutionize cardiovascular disease management, we now have a platform that allows you to go through what you need to go through to not only get the investment capital, but also the metrics that you need to ultimately get reimbursed.
Well, and I think this is where it's interesting to Google, because we're a technology company. We're not familiar with the regulatory and the process of how do you get something not just to be a wellness device, but to be a medical device. And that's where the collaboration with Healthy Heart and other companies, medical companies comes in.
I think one thing I want to add there, I think is a process also that works both ways. I think there are a lot of things that are done in the pharma industry that can change and will change because of what digital health can bring to the table. So, the cost and the time to actually set up a clinical study, also in terms of validating a new drug, can change dramatically because of our technologies.
Yeah, I think that's absolutely a great point. We shouldn't really put the picture out there that pharma isn't interested, the life sciences companies aren't interested. We've met with over a dozen of the major life sciences companies that have come and said, okay, we've got ideas around digital health. What are you guys thinking around digital health? How can we start working together so that we can use these tools to accelerate the discovery process, but also importantly, accelerate the clinical trials process? And I say, go talk to these guys, because that's what they're already doing. They've figured this platform out. You guys shouldn't be building it yourselves. And one of the things that we frequently stumble on as we go through these, not so much with the life sciences, but with the technology sector, is this lack of experience and the cultural difference of exactly what Tuan was talking about. It doesn't make sense to a company that's used to new product cycles that are a year long or at best 2 years long to go through the process of this validation of collecting data that really might not get you anywhere towards selling your thing. Mm-hmm. So talk to us a little bit, Margo. How do you really wrap your brain around that you've got these tight time cycles, you've got to get these things out there, yet you've got academics who are sitting there saying, no, you can't just put this stuff out there. You've got to rigorously test it, pretend you're selling a drug, essentially, to get this thing out. Then you'll be successful. What's that sound like to you?
Well, I guess, first of all, the FDA likely does make a difference between validating a drug and validating certain other type of technologies or medical devices. And that makes a difference to us. But from our point of view, there is a lot of value in giving transparency and confidence to the actors in the ecosystem that a certain product is going through rigorous validation, has been demonstrated to work and perform according to what everybody needs, right? And so I think the answer is probably to find something that is somewhere in between the rigorous, maybe sometime, but yet sometime maybe too rigid processes that you need to go through, maybe with from a regulatory point of view, with the ability to really kind of drive this change in a way that can be easily adopted by everybody.
I think that's a great point, and that's certainly another transformation that's happening in the industry, right? So the FDA has acknowledged they don't really know yet what to do with this space, and they're looking for help. At UCSF, we have the Center for Excellence in Regulatory Sciences that we partner with that that looks at how we should really evaluate these things and what kind of data you need to really convince people that they're safe, that they're effective, and it doesn't need to be like developing a drug. But it also can't just be another, oh, well, there's such a thing as an EKG device, therefore anything that measures an EKG is all right. It can't be that end either. Greg, you would?
So sorry, just to add on to that and expand it a little bit, because we're talking a lot about validation, but I think what's needed and what we're especially interested in Healthy Heart goes beyond that, and I think that there's a lot of interest from industry here as well, at least I think there should be. So there's the FDA side, which is really focusing primarily on safety, which I think for these particular devices is a somewhat low bar, certainly compared to drugs and interventional devices. Then there's kind of simple validation like this, like the AliveCore device. Yes, indeed, this EKG is validated versus a 12 lead, and it's showing us the rhythm that we're interested in. That's relatively straightforward. The third thing that is much more challenging, and companies don't have to wait to do this in order to get their product on the market. I think it's determining the best use of that product and potentially helping to advertise or market that product, and that is to figure out, to determine who is this going to help. How are you going to get physicians on board with, yep, this actually helps my patients, and insurance payers on board? In order to get insurance payers and physicians and medical societies on board, showing that this device, in fact, records an EKG isn't going to get you anywhere. What you have to show is that using that device in some sense makes care more efficient, makes care more efficacious, et cetera. And those are the sorts of things that you can do with Healthy Heart, where we're collecting data on real outcomes, hospitalizations, death, stroke, heart attack, et cetera, physical activity, quality of life. And I think it's those sorts of outcomes that are of ultimately the greatest interest. And with a long-term vision, that's where companies will really be successful.
And just as a patient participating in Healthy Heart Alliance and the study, the fact that we can consume less health care, I as a patient, because I am less anxious and frightened because I can't tell what's going on in my body. I'm 100% pacemaker dependent. I have to have blind faith that thing is working. But if I have, something that the AliveCore device or a heart rate monitor, those give me that window into what's happening. I then feel safer, I'm more confident, and that means it's one less trip to the doctor to go get that information because I now have that right here with me.
Right. And that's great because, to editorialize a little bit, the old world of where the trip to the doctor was inconvenient for you but generated money for the system, that old world is going away pretty quickly. And, in the very near future, we're going to be responsible for caring for populations of patients as effectively and as efficiently as possible. So historically, what Greg was talking about was really hard. You tried to get payers to pay for novel approaches, and they say, I don't want to do that. That's just going to generate more cost in the system. Even if you can do it more cheaply, it's going to generate more visits, more this, more that, and there was no interest. But I would encourage everyone not to get too sucked into that because the new world is looking very different. And things like telemedicine have kind of suffered. You probably heard this already historically because the payers didn't want to pay for it because it might generate more activity. But as we become at risk and as we care about patient engagement, and it's really important that our patients are happy with the service, the system is going to start paying for that and engaging in those new technologies. So if you're looking where the puck is going, I think you have to look at payment for these new devices in a fundamentally different way once you get the validation that they do bring value to the system.
I think there'll be new models of care, just to coda that. There'll be new models of care driven by new business models that really optimize the value of care, which is really exciting, right? So it's more than just, here's a device, here's a clinician, it's got to flow into the EMR. There's going to be a whole ecosystem of service providers and other tools that fit into the healthcare delivery process that is going to be aweson.
Right, even if it goes to the EHR is a big question. Where
exactly,
does the stuff need to go?
Yeah.
I think
How
one
useful
of,
is it? Yeah.
in many ways, the glue that kind of can keep all of that together is driving compliance as well. Right? Patient compliance is one of the key issues, and you look at behavioral models; they all show how the more value you get out of something, the more likely you are to go and do it. And by empowering patients, by having devices and tools that make patients more comfortable and involve the patient a lot more, that drives the value to the patient. That gets the patient to be a lot more compliant. And by the way, you can also make the doctors more aware of the level of compliance that patients have in real time.
Right. I think that's a great point because I have this great slide of everyone's drawer that has 25 wrist-worn devices that they used for 3 months and then ended up in the drawer. And when you survey people and you learn about this, because they didn't get value out of it, and it didn't interact with anyone, and it was cool for a little while, but it didn't really get there. So one quick last question, because we're over time. Just real quickly though, one of the things that's been difficult, and I'll direct this to you, Margot, is historically it's been difficult to work in these trials in this academic environment. The IP issues were difficult, doing the deals, but you've kind of gotten past all that. Talk a little bit about, just briefly, where you see the value and what it's been like. What do you see that you're bringing to this that made you get over the hump with it?
Yeah, I think the value is in many ways around what Greg and Tuin were mentioning. So you can keep on building layers of new advantages that these technologies can bring to the table. And so you don't have to go to the market once you have proven everything that is possible, and you can over time add more and more uses to the products and to the solution. From our point of view, what we decided to do was actually go full stack, as you say, so being able to provide a complete turnkey solution so that you need to involve less parties and bring less parties to the table. And so when we have somebody like the LTR study, we can go and really bring everything that is needed to make things happen.
Great, great. Well, so we're out of time, so I certainly want to thank the panelists. I want to thank, because I love the Healthy Heart study and where we're going and how we're going to manage populations. Thank our partners who have come to it. I think we don't have time for questions right now, but I know folks are going to be around for a little while, so I encourage you to engage with them, pick their brains, figure out how they got all this stuff done, and we're going to stop there.
Yeah, thank you, Dr. Blum. Fantastic. Excellent. Healthy Heart. They actually have tables over here, so make sure to go check them out at the playground.